The Western Montana Area Health Education Center is located in Missoula at the University of Montana in the heart of the mountains. Formed in 2008, our mission is to enhance access to quality health care, particularly primary and preventive care, by improving the supply and distribution of healthcare professionals through community academic educational partnerships. We connect students to careers, professionals to communities, and communities to better health. And we are currently involved in a $15 million project to improve healthcare education within Montana's two-year college system. Montana is vastly rural with wide open spaces and very low population. Its rural heritage sets the tone for the entire state. Keeping our rural citizens healthy with access to quality health care and thus improving their quality of life is Western Montana AHEC's greatest passion. In 2011, the Rural Behavioral Health Primary Care Collaborative was established with the Health Resources and Services Administration Rural Healthcare Services Outreach Grant. The project grew out of Montana's extensive need for mental and behavioral health services in our rural and frontier areas. Two issues in particular add to the difficulty of recruiting behavioral health specialists to rural locations. First, the majority of healthcare professionals end up practicing where they train, and clinical social workers and psychologists must have 2 years and 1 year respectively of supervision before they can receive their licenses. This leads to the second issue. There are very few, if any, licensed psychologists and social workers in rural and frontier regions. Thus, there is no one to provide supervision. Not only is there a problem with access to mental health services, but there is also the issue related to the stigma of obtaining these services, even if they do exist. Rural communities speak of living in a fishbowl, meaning others can easily observe them coming and going from a mental health provider. To address these problems, the Rural Behavioral Health Primary Care Collaborative developed a partnership between Western Montana AHEC, the University of Montana Department of Psychology and School of Social Work, 3 Critical Access Hospital rural health clinics, and 2 community health centers. Our current sites are located in the towns of Libby, Deer Lodge, Glasgow, Plains, and Kalispell. While Western Montana AHEC directs the program, this innovative project utilizes university faculty to provide distant supervision during their pre-licensed practice period until such time as they receive licensure. The psychologists and social workers are employed by healthcare facilities as full-time employees and remain employed post-licensure. Impact of the program has been immeasurable, so much so that state Medicaid and Blue Cross Blue Shield of Montana have made provisions to allow for pre-licensure patient billing. The pairing of a psychologist and social worker at rural sites has the benefit of reducing professional isolation. Additionally, locating these specialists in primary care clinics reduces the stigma associated with mental health treatment, and doctors can make referrals to the behavioral health specialists down the hall. These behavioral health specialists are in a unique position to work alongside physicians and directly intercept those patients who are in need of behavioral interventions to improve their overall health. Co-location of behavioral health specialists and physicians eliminates the need for patients to visit a new facility for additional care, thus increasing rates of follow-through. In turn, this leads to successful interventions, resulting in an overall increase in health and better patient care. We are very fortunate to have this groundbreaking program in Montana, and we look forward to adding new sites and telemedicine services in future years. Thank you for distinguishing us with the 2015 Outstanding Rural Health Program Award. We greatly appreciate the recognition.